Late Night Talking on 102.7 WMOM 829, 29 minutes after 8 o'clock here on a snowy and cold morning on a Friday morning. Welcome to it. It is winter blast, at least for the day today, back into the 30s tomorrow, which is going to be kind of nice. In the studio with us, so we have a couple of special guests that you can watch this on our Facebook page at WMOM, as well as our YouTube channel at 102.7 WMOM. And it is Taylor Hagland. Taylor, a daytime crisis clinician, and as well Amanda Van Huysen, mental health clinician there at West Michigan Mental Health right here in the area. Taylor, welcome to the studio, and thanks for coming in this morning.
Thanks so much for having us.
Absolutely. And Amanda, thank you for stopping by here here at the station, and we appreciate you being here too. Thanks for coming in this morning. We're going to be talking over the next couple of minutes because Taylor, there is this importance out there that if we are in a spot that we need help, we need to be able to reach out to somebody immediately. And in most cases, and in the past, it has been a call center where we don't get a kind of a live body there. Sometimes, we'll call you back, and so on and so forth. People need to have immediate reaction, especially if they're in a situation that they can't handle, right?
Yes, absolutely.
Let's talk about that, and let's talk about the program of CSS at West Michigan CMH and why someone should call that. First of all, CSS, there's when we talk about healthcare in general, there is a lot of those acronyms. There's abbreviations that are out there. Tell us what CSS is, if you don't mind.
Sure. So CSS stands for Crisis Stabilization Services, and that is part of our service array that we provide at West Michigan CMH. And we are the crisis team, so we can come out and meet with people in the community and provide that mobile crisis service.
So are you the people that are on the other side of that line when somebody calls that hotline?
Yes, absolutely. So actually what happens is between the hours of 8 and 5 from Monday through Friday, that number rings right to our front desk.
Okay.
So if somebody is calling in and they're looking for that mobile crisis service, or they're experiencing a mental health crisis, you can just tell the secretary staff, hey, I need to talk to one of the crisis clinicians, and we are available. Now, after hours, when we don't have front desk staff available, that number rings to an answering service called Protocol.
Okay.
And Protocol is going to grab some demographic information from you, so like name, date of birth, age, things like that, and you can tell them, hey, I need to speak to one of the crisis clinicians. And we are always available, so that's 24 hours a day, 7 days a week, 365 days a year, including holidays.
Do you get that call in the middle of the night? Does that happen?
Absolutely. So we do get calls, 2 a.m., 3 a.m., 4 a.m. Mental health crisis doesn't have a schedule. It doesn't operate just between the hours of 8 and 5.
Yeah.
So that service does need to be available.
And Amanda, with a crisis like this and somebody going through and needing to make that phone call, how difficult is it when you have those conversations? How difficult is it for somebody to pick up that phone, either themselves or a family member, to do that reach out?
It can be extremely difficult. They may feel like they're very alone, so just taking that first step and reaching out is huge, but we just want to provide some reassurance that we're there on the other end to provide that support and walk with them through the journey that they're experiencing.
And you have to be able to, and I want to talk to the two of you a little bit about this morning. Some of those questions that you ask them, I don't think because we don't, we don't experience this as much, or at all, calling the crisis line. But Amanda, when a call comes in, what are those initial questions that you want to ask that person, that you want to try to pull out right away? I would assume, and we've heard this a lot, is, are you in a spot where you might harm yourself or harm others? That, I know that's probably a given, but let's go deeper, if you don't mind. What are some of those questions you ask?
What they're experiencing, possible contributing factors. Like you said, safety is, the first and foremost, but, kind of what's been causing, the crisis, if there's any situational stressors that they're experiencing, or, any issues that may have contributed to their call. What's going on? So figuring out the problem can help us best figure out what we need to do to support them and provide resources that they need.
And Taylor, when somebody makes that phone call, it takes a lot for somebody to make that phone call, right?
Yeah, absolutely. The phone can be extremely heavy when you're experiencing that mental health crisis. And that's why we're here and we want to make that reaching out easier for people.
And we're going to share that phone number throughout this segment so that you know. We'll make sure that it's on our Facebook post as well as our YouTube, that 800-992-2061. And Taylor, how convenience not really the right word, but that accessibility of somebody, because when that phone call rings, there is almost a, hey, we have an urgent matter, almost an emergency in that situation where you have to respond from the CSS team. You're dropping things that you're working on to react to that. Is that crucially important?
Absolutely. You have to be dynamic. So, for example, we have to be ready at any moment. Once we're on for the day, we need to be ready to respond in any of our 3 counties. That can be at the end of Lake County or the end of Oceana County. And we really want to make that as easy as possible for people. So, what that looks like, we can meet with you in your home, maybe in a parking lot, in a community center. Anywhere that's convenient for you.
Okay, so let me get this straight. This isn't just a phone call conversation. This is, you can actually react, jump in the car, meet with them where they need to. And how often does that happen?
Yeah, sure. So we go out quite often, actually. For example, I think we were out twice yesterday. And truly it is feast or famine. So we could have 0 calls one day and we might have 7 the next day. So that's why we are always ready to respond wherever we're needed.
We're talking with Taylor Haglund, daytime crisis clinician, and Amanda Van Huysen, mental health clinician at West Michigan CMH. Amanda, the reasons why people are calling the Mobile Crisis Services Hotline and talking to the CSS team, do you mind sharing, what those scenarios are? Why are people calling? I would assume that, suicide is one of them, but that's just on the surface. What other issues do you see come into West Michigan CMH?
Absolutely. If they're experiencing suicide, that's, passive suicidal ideation is a big one. Other ones could be just struggling to handle things emotionally, depression, things like that. If they're having just a hard time with situational stressors or, be experiencing loss, they give us a call and we can try to support them through that.
So it really isn't, it isn't always what we feel as the most extreme of extremes. It can be in their lives something that is, a high anxiety or worrisome or something like that. It doesn't have to necessarily go so far that from our perspective, there's a major reason why they called. Sometimes we just need to be able to have that conversation, right?
Absolutely. Anything, can be, for a person very heavy. And so if they need help, with whatever they're experiencing, there's no, it doesn't necessarily have to be just the suicidal thoughts. It can be that high anxiety, that depression, anything that they're, feeling a challenge with. They can give us a call. Absolutely.
The CSS team, and I know, Taylor, you've been with West Michigan CMH a couple of years now, right?
Yes. Yeah.
And the CSS team, how important is it in the healthcare category to have that? I know we talk about, whenever we get sick or an illness and so on and so forth, but mental health is very important, right?
Yeah, absolutely. So we talked about mental health crisis don't just stop at 5 p.m. when the agency closes. So that crisis team that works 24 hours a day is very important to people because we can sit with people in those uncomfortable moments and potentially avoid a higher level of care like a hospitalization.
What about the question, and we brought this up before, from a mental health standpoint, and I've heard this, and tell me if you can dive into it a little bit, is you want to try to avoid any additional actions happening, like law enforcement being involved and such. Why is that? Why is it important, and how do you take that initial step to just kind of cool the situation?
Sure. So we talk a lot about not wanting law enforcement or hospitals to be dealing with these mental health crises. They're not trained in this. We are able to provide that service. So we want to avoid the drag that we would place on like law enforcement or an emergency room and be able to stabilize that person in the community. And really, we want that person to get the best services possible. And that can look like the crisis team coming out and connecting them to the appropriate resources.
What about, Amanda, when it comes to family members? Is the CSS team responsive to maybe that person that is observing things happening in front of them, or concerned about somebody in their lives. Is the CSS team there for them as well?
Absolutely. We're there to kind of wrap around, the individual experiencing crisis, but the family as well, providing that support. It can be really hard watching your family member or friend go through something. So we're there to just kind of provide guidance and help, any way that we can.
What about the person that is hesitant for calling? There's always that fear, that nervousness. Is this going to change my life? Obviously from our, when we're looking in, we hope that that's something for the better, right? We want to be able to help as many people as we can in our lives. But what about that nervousness, and how do we get past that nervousness?
Absolutely. It is very uncomfortable to kind of reach out and let people know that you have, a struggle, but just know you don't have to suffer in silence. We are there to support you, help connect you with things you might not even know that are there, just making it easier for you to go through the journey.
All right, we're talking with Amanda and Taylor here in the studio. We appreciate you coming in. Let's talk about the mobile crisis services, specifically for who can call. What's the available? In regards to the region, we talked a little bit about Lake Mason, Oceana County, if anybody's in there. But Taylor, can anyone call this number?
Absolutely. So we serve adults, children, families, anybody in Lake Mason or Oceana County we can respond to.
And it's not just a one-on-one. It sounds like there's a team effort when it comes to this. Explain that for me, if you don't mind.
Yeah, so we come out as a team of two. So there's a master's level clinician that is the lead clinician, and then there's also a secondary role. So I'm the paraprofessional role on the team. We come out always as a team of two for safety, and we really want to make this a collaborative effort. So all of us are kind of having a conversation and facilitating a conversation to make sure that person is supported in that moment.
And so break down those two roles, because it's if a little bit farther, if you don't mind. What is it? Because I would assume that two people, and then in that same environment with somebody that is going through that nervous, can be a little bit concerning. Hey, two people are helping me now. Where most people may be thinking of one-on-one, but why is there that two? Break that down for me a little bit further, if you don't mind.
So the reason for the two really is safety, to make sure we're not sending anybody alone into an environment that we haven't been in before. Okay. And additionally, the dynamic of the team is very important to be able to support people. So like I said, Amanda is the master's level clinician on the team, and then I am a paraprofessional role. So I actually have training as a peer. I'm somebody who has experienced mental health crisis services before, and I can really connect and relate with people on that level, whereas Amanda is doing more of the assessment, the interventions, and making a plan and making sure that this person is supported.
That's important. It's an important environment, it sounds like, in regards to that. And do you mind sharing your past? Because obviously you're going to share that with that individual too, right?
Sure, yeah. If it's appropriate in that moment, I'm always willing to share that information. So I experienced substance abuse for about a decade, and I've been clean for about 4 years now. So that was a obvious tumultuous time in my life, and now I'd like to give back to the communities that I live in.
Well, thank you for doing that. We appreciate that, and congratulations on the 4 years as well.
Thank you.
Amanda, on the side that the counseling side that you take, we talked with Taylor, and Taylor is talking with that individual on actual real life scenarios that he and moments in his life. How do you do that assessment so that person feels comfortable in that scenario?
Absolutely. We try to make anything as personalized as we can, not just standardized questions. We try to, really get to the consumer and figure out what those needs are by doing the assessments and figuring out, what approach is best to take.
Okay. We're talking with Taylor and Amanda this morning from West Michigan CMH. We've covered a lot. And we want to make sure that we're sharing that number, 800-992-2061. The mobile crisis service available for anybody in Mason, Oceana, and Lake County. And Taylor, my last question to you is this helping? Are we seeing actual people and saving lives out there?
Yeah, so I like to think that we're helping people. So, for example, we've had cases where people are experiencing suicidal ideation and we're able to meet with them, stabilize them in the community, and avoid an actual mental health crisis or somebody actually losing their life. And that's really our intention, is to come alongside people and support them in this very uncomfortable moment. And like we said, the phone can be very heavy, but we just want you to know that we are here.
All right. Anything that we missed today that comes to mind, Taylor, we'll start with you, that we want to share with the audience.
No, I think we're just grateful to be here and to be supporting our community.
All right. We appreciate that. Amanda, same question to you. Any thoughts on something that we might have missed today?
Just can't stress enough that phone line is available 24/7. So if there's any time, regardless of the day, the time, reach out.
Okay, great information there. Amanda, Taylor from West Michigan CMH, we want to thank you for all that you do. Thanks for helping those in the community that need the help. And if you do need help, if you know somebody that needs help, reach out to West Michigan CMH. Again, 800-992-2061. We'll put this on Facebook. We'll put this on YouTube. And you know, we want you to know that as we started this segment, there are people, and you can see them right here in the studio to help. So Taylor, Amanda, thanks for coming in today.
Thanks for having us.
Absolutely. 8:45 now on 102.7 Mom FM.
Picking up your workday like a sugar rush from a double glazed donut with sprinkles. Yum.